Okay, good morning, Christina. My name's Simon Dowling. I'm going to be an exercise physiologist today. How are you?
I'm very well, thank you. How are you?
I'm well, thank you. Now, with your permission today, I'd like to ask you some questions with regard to your medical history, your lifestyle and levels of physical activity. This will allow me to make an assessment so that we can move forward and help to improve your health and well-being. Is that okay?
Yeah, that sounds great.
Now, I understand you've been referred to me today by your obstetrician, Dr. Forceps, for management of gestational diabetes prior to the birth of your child.
Yes.
You must be very excited. Do you know if you're having a boy or a girl?
Yes, I am excited. My husband and I are going to wait until the birth to see what sex the little one is.
And what is your husband's name?
John.
And do you have any other children?
Yes, we have a 4-year-old named Tyson.
They must keep you busy.
Tyson can be a bit of a handful at times, but John is great. He lets me rest as soon as he gets home from work at 5.
That's good to hear. Do you have any other help throughout the week?
Mum and Judith, my mother-in-law, are at home one day a week each, which gives me time to do some part-time study.
And how have you and your family taken the news of your diagnosis?
It was a real shock and it really scared my husband and I.
I know how that can feel, but often it's good to have these little scares. Sort of lets us know that we need to take a little bit better care of our bodies. How was your first pregnancy?
Aside from some weight gain, it went very smoothly.
And what is your understanding of gestational diabetes and some of the risks associated with it?
The doctor was really good in explaining it to my husband and I, but I got a little bit lost when he was talking about the associated risks of gestational diabetes.
Okay, now on a scale of 1 to 10, 10 being really confident, how confident are you and your husband in the treatment that we're offering?
Oh, about 6 or 7.
I understand you completed a 12-week program prior to getting pregnant.
Yes, I managed to lose 4 kilos, but I was so exhausted, and since becoming pregnant I haven't had the energy to maintain any exercise regime.
And aside from the exercise, how do you feel the lifestyle and dietary modifications are going?
I've enjoyed the eating plan and learning more about what foods help to maintain healthy weight.
And have you consulted with a dietitian post becoming pregnant?
No, I haven't.
And prior to commencing the exercise program, were you given any information regarding the positive effects of physical exercise on the body?
No, I pretty much went to a personal trainer to lose weight.
Okay, today I will go through some of the benefits of physical activity and more importantly how they are going to help control the gestational diabetes. And furthermore, we'll help to reduce the risk of you having any further complications associated with the gestational diabetes. If I give you some information pamphlets, will you be able to take John through some of these at some stage in the next week?
Yeah, I think you'd like that.
That's great. It's best that you both have all the information you need for us to all move forward. Now I can assure you your condition isn't uncommon, but more importantly it is manageable.
Thank you.
Now, what is your date of birth?
The 4th of the 4th, 1986.
And have you been diagnosed with a heart condition, and do you have any family history of heart disease?
No, certainly not in my immediate family.
And do you have any unexplained chest pains at rest or when you exercise?
No.
Do you ever feel faint or dizzy during physical activity?
No.
Have you had an asthma attack requiring medical attention in the past 12 months?
No, I haven't.
Now you've got diabetes. Have you had trouble controlling your blood sugars in the past 12 months?
Yes, I've recently been put on some medications for meals and night time.
Are you taking any other prescribed medications?
No.
In the past 6 months, how much physical activity would you do a week?
Oh look, I really haven't done much at all. I might run around with Tyson for 5 minutes here and there, but I'm really just struggling with my energy levels.
And typically, what would that involve?
He likes to go down to the park and play soccer. I usually join him for 5 minutes and then sit somewhere and wait for him to tire out.
And what types of physical activity do you enjoy doing?
I used to love going to the gym because it gave me some time to myself.
Yep. And is Tyson at home during the week?
He goes to preschool 3 days a week.
And what do you typically do when he goes to preschool?
I get up with John and get Tyson ready for school, then drop him off. I usually just do whatever needs to be done around the house and then do some study. I usually get tired around 2 in the afternoon and have a nap for an hour or so.
And do you regularly get tired around 2 o'clock in the afternoon?
Yeah, it's pretty much like clockwork.
And would you be interested in doing some more one-on-one training, just a little less intense?
Yeah, I really would. I don't really want my baby to have to deal with any undue stress.
And what would you like to get out of the program?
Firstly, I want my baby to get the best out of life, which means I don't really like the insulin medications, so I'd like to get off them. I'd like to be able to spend more time playing with Tyson, and I guess I'd like to know more about the associated risk of gestational diabetes.
Great. It seems to me your children are your main priority. It's important for us to make sure you are strong and healthy for your kids.
Yes, it is.
Now, does your husband do any exercise?
He's pretty good physically. He could do a little bit better.
Does he do any formal exercise?
He has a landscaping business, so gets plenty of exercise during the day. Then he and Tyson will play for an hour when he gets home after work.
And does he have any trouble keeping up with Tyson?
No, none at all.
Would you like to be able to incorporate some of this playtime into your program?
Oh yeah, I think that'd be great.
Now, moving on to gestational diabetes specifically, what has happened is that your body has become resistant to insulin, which is a hormone your body needs in order for your cells to take sugar from your bloodstream and use them for energy. Now, because your body has become resistant to the insulin, you have too much sugar in your bloodstream and not enough in your working cells. During pregnancy, your body is producing a significant number of hormones which your body needs for you and your child to have a healthy pregnancy. These hormones can affect the way that insulin communicates with cells within your body, and this can further exacerbate the symptoms of diabetes. Are you following me so far?
Yes, Simon, I remember the doctor telling me this.
Good. Now, increases in your insulin and blood sugars can have an impact on your baby's health. Do you remember your doctor going through this with you?
Yes, I do, but I'm keen to learn more.
Okay, so one of the biggest risks associated with gestational diabetes is macrosomia. This happens when your baby grows significantly larger than the gestational age. Now, what this can do can lead to birth complications and can also increase the need for a caesarean delivery. Were you aware of this?
Yeah, I was, and it really worries me.
Now, whilst your condition is serious, the bright side of the situation is that it is very manageable. Another important risk that you need to know is that hyperactive maternal blood sugars can lead to hypoglycemia in your baby, which carries an increased risk of them developing type 2 diabetes later in life.
Oh, I really don't want to do that to my child.
I can understand that, but more importantly, we need you to be fit and healthy to handle the vigours of being a working mother. It is also extremely important that we prevent you from getting type 2 diabetes mellitus after your baby is born. This occurs in about 28% of mothers with gestational diabetes within 5 years of giving birth.
Oh wow, I didn't know that.
I don't want to scare you any more than you are, but you should also be aware of the long-term risks associated with having elevated blood sugar levels. This can lead to complications with your kidneys, your eyesight and cardiovascular system, which can further complicate and compound the effects of poor blood sugar control.
I didn't know it was that serious.
Serious in the long term, but luckily you are still young and have many more years to offer.
Yeah, that's true.
The vast majority of the research in the management and prevention of type 2 diabetes progression state that the most effective lifestyle modifications include risk avoidance, a healthy diet, regular exercise and a normal BMI. Now, prior to becoming pregnant, you had a BMI of 31 and a waist circumference of 114 centimetres. This, accompanied by a sedentary lifestyle, significantly increases your risk of gestational diabetes, but if continued, can lead to the development of type 2 diabetes after you've given birth.
Okay.
Now, the best part of this is it is all very manageable. The benefits of sustained aerobic and resistance training include improved cardiovascular fitness, increased muscle mass and strength, and a reduction in body fat. These help in the management of diabetes by improving glucose uptake into the cells, resulting from better circulation and increased exposure to lean muscle. Does that make sense?
Yes, it does.
There is also a large body of evidence which state that physical activity during pregnancy is highly beneficial for fetal development and maternal health. Some of these benefits include improved metabolic control for mother and baby, improved musculoskeletal and neural fetal development, as well as an improved circulation of nutrients and waste products away from the fetus.
Right, so the more I work my body, the better it is at supporting my baby into life.
Very close. There are obviously some limitations to how much and how intense the exercise we want you to be doing is, but certainly if you stick to the program, you'll be giving yourself and your baby the best chance possible. Now, the guidelines for exercise during pregnancy say that exercise should be done on at least 3 days of the week, preferably every day. For 15 minutes, increasing to 30 minutes is tolerated at a moderate intensity. Moderate intensity limit on exercise is used because of some of the physiological changes that occur in your body during pregnancy may be exacerbated by the physical activity, but it's perfectly safe at this intensity. Do you think you would be able to do 15 minutes of exercise on at least 3 days of the week?
Yes, I think I might try 5 days.
That's awesome to see that you're having that initiative so early in the program. What you will also need to be cautious about is exercising around your insulin medications. Did your doctor explain any of this to you?
No, he didn't.
So when you exercise, your body will naturally produce higher amounts of insulin because your muscles need more sugar from your bloodstream to work. For this to happen, insulin must be present to allow sugar to enter your muscles to be used as energy. An issue which may arise from taking these medications and exercising is the possibility of having a hypoglycemic event, which would be caused by too much insulin in your bloodstream and hence not enough sugar to maintain normal body functions. It is recommended that you exercise outside of these peak insulin activity periods, meaning you should wait at least 1.5 to 2 hours after taking these short-acting insulin medications before exercising. And to be cautious, avoiding exercise late in the evening, especially close to your nighttime intermediate insulin medications. In saying that, would you be able to do some type of exercise before 3 p.m. on most days?
Yeah, I can do that.
Do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
Yes, I have some lower back pain and I do get puffy feet near the end of the day.
And have you sought any help for these issues?
Not yet.
Would you be interested in seeing a chiropractor and podiatrist to help rectify those issues?
Yeah, but it sounds very expensive.
Yes, our help can be expensive. I only offer this as it is beneficial that we get a full picture, so as to when it comes to doing the actual physical exercise, there may be some focus areas that we need to work on. In doing this, we'll be able to help relieve you of some of these discomforts. I can help you look at some funded schemes which could help the treatment become more affordable if you are interested.
Yes, that'd be great.
Now, moving forward from our discussion today, I've classified you as a moderate risk client. What this means is that I would like to get some clearance from your GP before we begin an exercise program. The main reason for this is that you've had trouble controlling your blood sugars in the past 3 months. This isn't anything to worry about and is mostly procedural, so that we can be assured we are doing the best thing for you and your baby. After you've gained approval from your GP, we can start to assign a program which suits your availability and needs. I will also make a note to your doctor that a referral to a chiropractor for your back issues, a podiatrist for your foot problems, and a dietitian for an up-to-date assessment on your dietary requirements would be beneficial moving forward. Now, do you have any questions?
No, I don't think so.
Okay, thanks for your time today, Christine. It was lovely to meet you.
Thank you, Sam. It was nice to meet you too.
Now, if you have any questions, please don't hesitate to contact me.
I'll do that. Thank you.